review some muscles of the thighs really quick to make sure we all know what we're talking about. But we're going to be talking about just one group of muscles. Essentially, there are three large groups of muscles. Oh, wow, I didn't even think about that. On your thighs, there are three large sets of muscles. On your hips, there's one large set of muscles. And then there's a whole bunch of little sets of stuff. So let's first talk about the muscles of the pelvis and thigh really quick, just to see if we remember what they are as groups. And don't worry if you don't remember. You know how this goes. We just drill you and drill you again and all that kind of stuff. Okay? All right. Sounds good. Miss Sarno. Hi, Miss Sarno. Miss Sarno, can you tell me, and if you need help, I'm always happy to help you, but can you tell me the three gluteal muscles? These are the ones that make up your bottom and your hips. Yep. Your tushy.
Gluteal maximus.
Gluteus maximus.
Maximus.
Yeah. Miss Sarno, by the way, the first time was absolutely fine, but I just want you to hear it said by my voice too. But gluteus maximus.
Gluteus maximus.
What's the next one?
And gluteus medius.
Gluteus medius. Yep.
Gluteus medius. And gluteus. I don't know.
That's okay. Gluteus minimus.
Gluteus minimus.
Yeah, they're hard. They really are hard words. All right, so gluteus maximus, gluteus medius, gluteus minimus.
Gluteus maximus, gluteus.
It's okay. It's okay. You're doing great. You just said gluteus maximus, gluteus medius.
Gluteus medius.
Gluteus minimus.
Gluteus minimus.
Yeah, minimus. Minimus.
Sometimes it has, my tongue didn't move right.
Yeah, she said her tongue doesn't move right. It doesn't. You're coming from a language that, my language is closer to Latin than yours is, so you're going to have a very hard time. Literally, your tongue has never shaped some of these sounds, whereas the rest of us just have to rearrange our sounds.
Yes.
These are still fairly English-sounding things. We just make them sound whatever. You're coming from a different language. Just like if I had to speak your language, it would be very bad. Yes. Yeah.
Sometimes I have the problem with my accent. I still keep my Thai accent with speak English.
I like your Thai accent. Yeah. When I was in Thailand and I tried to tell people where I wanted to go, like in the tuk-tuk, and I tried to tell the tuk-tuk driver where I wanted to go, they didn't understand anything I was saying. I tried to say it exactly like they told me to say it, but they couldn't understand me. So I understand. It's hard. Yeah. So let's do it one more time though. Gluteus maximus.
Gluteus maximus.
Gluteus minimus. Oh.
Gluteus minimus.
I said them out of order. And gluteus medius.
Gluteus medius.
That was great. Thank you, ma'am.
Thank you.
We got 6 more months to go. You're going to have them. Don't worry.
Yes.
Don't worry about it.
I need to practice more.
We will. Don't you worry. You're fine. You're fine. You already know more anatomy than half the massage therapists out there. Trust me, you'll find out. You'll be very happy when you graduate. Miss Jong.
Hi.
Hi. So I want to know the 3 hamstring muscles. The 3 hamstrings are on the back of your leg. On the back of your leg, and I can say them with you if you want. I'm happy to.
后边呢，不知道是哪个字。hamstring。好的啊，后边腿。找不着。
We can do them together.
Yeah.
It's not a test.
Biceps, femoris.
Yeah. Biceps. I'm sorry, I was excited. Biceps femoris. Boom.
Biceps, femoris. Semimembranosus.
That was almost perfect. Semimembranosus. Yeah.
Semimembranosus.
You already said semimembranosus. So what's the next one? Semimembranosus.
the brain, nothing.
So, Miss Young,
Yeah.
you said biceps femoris, and you said semimembranosus. Can you tell me semitendinosus?
Tendinous.
Yeah, say that.
他要读了吗？
这样你说。
安排。biceps femoris.
Yeah, femoris is actually correct too.
Semimembranosus.
Semimembranosus.
Tendinosis.
Well, that's the next semitendinosus.
Semimembranosis.
Yes, that one is really stuck in your head. But say semitendinosus.
Tendinosis.
Thank you. Yeah.
Thank you.
Thank you, Miss Shong. By the way, everybody, the way she's saying like femoris, some people say femoris. So just to let you know, there's that much variation. If you go online, if you want to do something fun, go online and look up all these terms under a British accent, and they sound dramatically different. So just to let you know, the way Tapscott's saying them is not like the God-spoken only way to say this stuff. You will talk to other people to be like, it's the biceps femoris or the femoris or the whatever. They have all sorts of different stuff. Anyway, you're doing great. Thank you. Okay.
Thank you.
Miss Karodi, can you tell me the five hip adductor muscles that are in between the legs? These are hard. Of course, that was hard.
Yes, I can say that. Adductor magnus.
Yeah, adductor magnus.
Longus.
Adductor longus.
Adductor brevis.
Adductor brevis.
Yeah, gracilis.
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 Yeah, that was hard.
Pectini. Yeah.
Pectineus. Beautiful. Thank you, ma'am. Beautiful. Okay, cool. And Miss Hawks, I'm sorry to put you on the spot. I know you weren't expecting me to call you, but Miss Hawks, do you know the four quad muscles, the four quadriceps femoris muscles that live on the anterior and lateral compartment of your leg?
Yeah.
Oh, cool. Can you tell us them?
Yes. The vastus intermedius, vastus lateralis, vastus medialis, and the rectus femoris.
Yeah, and those are the muscles we're going to be studying today, everybody. Okay, cool. Is the four quadriceps femoris muscles. Mr. Brown, sir, I know that you're probably putting clothes on right now, but Mr. Brown, don't leave me hanging. All right. Hey, Mr. Brown, what are the four quadriceps femoris muscles that Miss Hawks just told us?
I'm sorry, I stepped out of the room. I was taking the trash out.
Okay, which is a good son, a bad student. All right, so, all right, do you know what they are? Do you want some help?
The quads are, so Sydney, those are in the back. Got the vastus medialis, vastus intermedius, vastus. I forgot the last vastus, but the other one is rectus femoris.
Yeah, so I think you got medialis. Did you get intermedius and then lateralis?
Lateralis, that's the one I missed.
Cool, thank you, sir. Mr. Placencia, what the heck does quadriceps femoris mean? Like if you had to translate that Latin, what does it mean?
Four-headed muscle on the femur region.
Wow. Sometimes I feel like you're in my head. That's exactly what it means. Quad means four. Ceps means heads. We're going to use that a lot. Quadriceps femoris, the four-headed muscle found on the femoral region. And these are on the front and the side of your thigh. Front and side of your thigh. Cool. Thank you. Miss Trotter. What are the four quadriceps femoris muscles?
Vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris.
That was absolutely beautiful. Thank you, ma'am. Thank you. Miss McDowell, I'm just wondering what I should ask her. Sorry. One of those muscles actually runs across 2 joints instead of just 1 joint. Do you know which one?
Rectus femoris.
Good. Yeah, apparently you've been paying attention. That's good. All right, cool. Let's talk about these today, everybody. I want you to well, let's look at some pictures. Let me show you a little slideshow here. Cool. Let's see. Doodle-doo. All right, boom. Okay. So hopefully coming into view, here we go. Hopefully coming into view is this. Okay, let's check it out, everybody. All right. So this is a good picture of a right leg. We are facing it. It's somebody's right leg. I hope you can see that the rectus femoris kind of runs straight up and down the leg and is the most, I mean, it's superficial. It's superficial. The vastus medialis looks like a little teardrop. I mean, a big teardrop on the medial side. You see that? And you see this muscle on people's knees. When you see a bump down here on people's knees, that's their vastus medialis poking through. You've seen this before on people. And then the vastus lateralis, I want you to recognize the vastus lateralis actually makes up the entire side of the leg. It's a massive, almost fish-shaped muscle. And when you see somebody, can you guys see the whiteboard for just a second? When you see somebody kind of standing here, and this is their leg sweeping out like this, and here's their knee. You kind of see their legs sweeping out like that if they're standing from the side. That's all vastus lateralis. It's the thing that actually gives the shape to the side of your leg. It's massive. The IT band actually runs right down here on the side of it. And why can we not see the vastus intermedialis, or intermedius? Sorry, I'm making up words. Why can we not see the vastus intermedius in this picture? Yes, well done. I like that. Yes, Miss Estes.
Well, I didn't raise my hand. Somebody else did.
Yeah, but then she took it down.
Oh, okay.
It's okay. Either way.
It's underneath, right?
Yes.
The rectus femoris.
Yes, almost directly dead underneath the rectus femoris. That does not mean, everybody, that you need to move the rectus femoris aside to get to it or anything like that. You don't even have to worry about it. It just means every time you're rubbing the rectus femoris, down below it is this muscle. Yeah, thank you. I just want to make sure we all had it kind of in our head. All right, moving right along. We're not doing that. Here's kind of a thing of what I was talking about. This is a side view of the leg. Do you see the sweep of this leg? That is basically all vastus lateralis on the side here. Cool? It's very important when you massage legs that you think of them as having 4 sides, at least, right? Because they really do, so that we're getting everything on them. So today we're kind of studying the top, the anterior side, and the side. It's kind of where all this stuff is found. Okay, hold on, we're not doing this yet. Boom, 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 bear with me. Boom. Okay, look at the picture up here in the upper right-hand corner. And what this person is showing you is a extension of the knee. So just to be clear, extensions, normally flexions happen in front of the body. This is the one that confuses everybody. Normally, if you see Tapscott bending in front or even heading towards in front, I can be way back here, but if I'm coming forward, I'm flexing my wrists, I'm flexing my neck, I'm flexing my torso. These are all flexions, but the knee is the one thing that faces backwards. So extensions happen in front with the knee. And when we're talking about extension, we're truly talking about you kicking with this leg down here. So that. I am extending my knee. Cool? Extending my knee. And literally, just to be really clear on this, literally all the quads come down here, grab onto this leg, and extend it. That's what they do. All 4 come down here to extend the leg. You obviously use that a lot if you're squatting to get back up again. Use it if you're kicking, all sorts of stuff. Cool. So, the number one main thing the quads do is extend the knee. They do one more thing, but we'll get to that in a second. All right, let's look at them. Okay, so on the left-hand side, we have the superficial quad muscles, and on the right-hand side, we have the deeper quad muscle that Miss Estes correctly explained to us was hidden under the rectus femoris, right? And that's the vastus intermedius. But really, these are named like in a really cool way. The vastus medialis is on the medial side of the leg. The vastus lateralis is on the lateral side of the leg. The vastus intermedius is between them, between. And the rectus femoris is this long straight up and down muscle on top of all of them. So they're pretty much named by location. It's super helpful. If you look at the three vastuses, let's just forget for a second about the rectus femoris. The three vastuses have an origin on the femur and go into the tibia. So let me explain what I mean by that with the skeleton here. In fact, let me stop sharing for a second because you might need to pin me to your screen, who knows. But let's be really clear. So, come here, Skelly. All right. So just to be clear, all right, we can get carried away. All right. All right. Can we see this guy? Yeah. Okay. So here's the skeleton here. This is its femur. It's its tibia down here. So I want to be very clear that even if you don't remember exactly where all these start, they all start from the femur somewhere. So essentially, the vastus lateralis starts from the femur here. It comes down and hooks into the kneecap and then into the tibia. The vastus intermedius starts here. It goes in the kneecap and goes down the tibia. Should I not tape? The vastus medialis starts on the femur, goes down into the kneecap, and goes in the tibia. So these three muscles, the vastuses, are only hooked to your femur and your tibia. So when they contract, that's what makes your leg come out. When they contract, they pull on this to make your leg come out. And they're hooked on to this femur up here, and they're so big they're going to hook onto the back of the femur a little bit. We'll talk about that in a second. But I want you to kind of just think about this. They all actually hook into your patella, your kneecap, and then your patella hooks into your tibia. Why does every gal and fella have a patella? Anybody know? Why do we all have patellas? Because knobby knees are sexy? I mean, they are. I won't even show you mine. It's amazing. Yes, Miss McDowell.
Isn't it to prevent your femur from going into your tibia and the fibula?
It's to prevent like one of the worst disasters that could ever happen. Yeah, if this was my femur and this is my tibia, when I squat down, the force causes my femur to want to go out here. You don't have to know a lot about anatomy to know that if your femur shot out across your tibia like this, that we would hear a noise we've never heard before in our life made by this area of your body and this area right here, and then you would bleed out in 30 seconds and die. It'd be it. So it's hard to think, but if you think about it, if there's a lot of weight coming down on this, that weight wants to still come down, and when it bends, it still wants to slide out. And the kneecap is literally there preventing your femur from sliding out over your tibia. Do you remember what kind of bone it's called, by the way? Miss McDowell, it was one of the first times that you correctly challenged me and embarrassed me publicly. Do you remember this? I know you do.
Sorry for embarrassing you. I think I did that with everybody.
I love it.
It's it's one of the floating bones along with the hyoid bone.
Not along with that. Anyway, it's a sesamoid bone. It's not along with the hyoid. By the way, you were right about that whole discussion we had earlier. But a sesamoid bone is actually wrapped in like tendon and ligament and fascia. So the hyoid bone isn't that, but you're absolutely right, it's a floating bone. Anyway, sesamoid bones are really powerful, thick bones that are wrapped in fascia in high tension areas to prevent stuff from slipping out. So I want to be really clear about how your knee works. Can we see? Yeah, we can see this. If this is a foot here, right? Well, let me not even put that there. Hold on. And this is your tibia. And this is your fibula here. I'm sorry, this is your femur. This is your kneecap. Your kneecap is here to prevent this thing from shooting over. All four of your quads go into this kneecap. That's what they do. You got one coming from up here. All four go to that kneecap, and that kneecap hooks into here. Right? So, what attaches muscle to bone?
Tendons.
Yes, sir, you nailed it. Tendons attach muscle to bone. Tendons. So, this is muscle, and the kneecap is a bone, right? So this is tendon. What attaches bone to bone?
Ligament.
Ligament. Very good. And this is ligament. It's all the same fascia, by the way. If we cut somebody open, it's not like the ligament is labeled ligament. You'd be like, oh, that's really white, hard, rubbery, rope-like stuff. And then I'd be like, look above the knee, and you'd be like, that's really white, hard, rubbery, rope-like stuff. We're naming it differently. But this is kind of an anatomy question people love to ask to see if you really understand how knees work. And the point is, all these muscles in your book, it'll say something really confusing, like all these muscles insert into the tibial tuberosity, which is a bump down here, via the patellar tendon and patellar ligament. And this is your patellar tendon and your patellar ligament. And that's how this gets into your leg, so that it can cause you to kick and keep your femur from coming out. And that's what sesamoid bones are for. They're wrapped completely in fascia, and they help this high tension area. You've actually got 10 of them in your body, but the two biggest ones are your kneecaps. And those are your patellas. And they're in this high stress area. So I just want you to kind of realize these massive muscles come down and grab onto the kneecap, and then the kneecap is then secured into your tibial tuberosity, and you all should be able to feel your tibial tuberosity on your body right now. It's below your knee, and there's a bump down here. There's a bump. You can't see it, so it doesn't do any good for me to. But there's a bump down here on your tibia, kind of about an inch below your kneecap. There's a bump there. Above the bump is some ligament. Then you go up the kneecap. Can you feel, Ms. Trotter? Are you feeling your tibial tuberosity right now? Or are you sleeping on me? That's what I thought. No, I'm teasing you. Anyway, that's your tibial tuberosity. Cool. So all four do that. All four insert into the same place. So it's kind of cool when you're learning origins and insertions, because you now know the insertion, the insertion for all four muscles. So if I go around and say, hey, what's the insertion for the vastus lateralis? You can be like the tibial tuberosity via the patellar ligament and tendon. So it's the tibial tuberosity, though, ultimately, right? It's got to get down to the tibia. And if I asked you that for all four muscles, the answer would be the same, right? So let's see, they might even have that in here. Yeah, so the insertion, the I, in this thing that you can't see because I'm not sharing with you. Hold on, I'm about to. Boom. I'll explain this picture in a second. So the I in this picture is the tibial tuberosity. That means ultimately these guys hook down in the tibial tuberosity, but they do it by going through the patella and the patellar ligament.
Mr. Trapscott,
Please, talk to me.
would we have to include the patella and the patellar ligament, or could we just say tibial tuberosity?
It depends. So it depends. it's important you know that it's getting to the tibial tuberosity through the patella. Does that make sense? But
Yeah.
when you I realize what you're asking. You're like, when I ask you this question, how do you want it answered, or if it's on a test? I won't give you a blind test where I'm like, oh, you forgot to say whatever. All your tests are multiple choice and things like that. But I do hope, and yes, I will press you to understand that it goes to the patella and then the tibial tuberosity. So however you say that, I do think it's an important fact to include.
Okay.
Yeah. So to answer your question, yes. Yes,
Yeah.
very simply put, please do. But you're right, we might not say it in every situation, but yes, please know that. So, but the good news is it's the same answer for all four
All of
muscles.
them?
Yeah.
Okay.
So if I said, hey, Miss Munoz, what's the insertion for the rectus femoris? You'd say,
The tibial tuberosity via the patella and patellar ligament.
wow, that's what you would do. Yeah, but then if I was like, Mr. Blygen, what's the insertion for the vastus medialis?
The insertion for the vastus medialis is, hold on, let me see this picture. The tib, down here, that thing. Yeah, the tibial tuberosity through the patella and the patellar ligament.
Cool. Yeah. I like, by the way, instead of saying via, he said through, which is this, it's correct. It's just a different word. So that's great. Thank you, sir. And if I said Miss Allure, what is the insertion for the vastus lateralis?
Tibia tuberosity via the patella and patellar ligament.
I love it. Yeah. And if I said Miss Vincent, what is the insertion for the vastus intermedius?
I would say it's the same thing.
Yes, you would. I actually really believe that. She's like, don't waste my time. But if you were in school and you had an annoying teacher and you knew that he wasn't going to go on until you gave the full answer, what would you say then?
Can you help me?
Yeah. Yeah. So it goes into the tibial tuberosity.
The tibial tuberosity.
Via.
By way of.
I like that better actually. By way of the patella.
The patella.
Which is the kneecap. And the patellar ligament.
And the patellar ligament.
Yeah, cool. Cool. Awesome. Thank you. Thank you. Thank you. All right, everybody. So all of these muscles go in there. We know they all cross the knee, so we know they have to create a movement at the knee. Anytime muscles go across the joint, they're going to move it somehow. Because these come over the top and they grab onto the tibia and kick it out, that's an extension of the knee. And that is the main action of these muscles. That's what all four do. In fact, 3 of them, that's all they do. 3 of these muscles, that's all they do. Miss Trotter, I feel like you understand that concept. Which 3 muscles which of the 4 quads only extend the knee? That's all they do. They don't have anything else cool they do.
Vastus lateralis, vastus medialis, and vastus longissimus?
Intermedius.
Intermedius, yeah.
You switch to like spinal erectors or something. I love it. That was great though. What I love even more though, Ms. Trotter, I could care less about the names. I love that you understood the concept, I could tell. So she understands the vastuses are all hooked onto the femur and they just hop across the knee and they insert into the tibial tuberosity via the patella or the patellar ligament and tendon. Boom, they're down in there. Let's talk about the origins of these 3 muscles, how they hook onto the thigh, because they didn't call them vastus for nothing. So the vastus lateralis and medialis are so massive that the picture that we are looking at right now is the posterior view of the leg. Now you will never see a leg like this because it'll have hamstrings back there, right? So Miss Walker T knows, we had to kill this person, remove their hamstrings. Don't roll your eyes because you'll be next. You know who you are. I know. Yeah, there'll be no more questions then. So if you remove the hamstrings for this person, and their glutes in this case, but the point is, you'd be able to see that the quads are so huge, we forget that people's thighs, I don't care who you are in this classroom, your thigh bone's about that big around, but nobody's thighs are this big around this classroom. I don't care how slender you are, your thighs are at least like this, if not like this, right? but your little bone is way down in here. That gives us a lot to rub. There's a lot going on in a thigh. Anyway, the vastus is so large, right? The vastus lateralis and the vastus medialis, that they almost grab onto the back of the leg. Do you remember when I talked about the medial and lateral lip of the linea aspera? It's a line, like a bumpy line that runs down the back of your femur. We won't ever feel it because there's just too much muscle packed up around it. But these guys are so big that they grab onto the back there because they have to kind of wrap around the thigh and start to build your thigh. So, remembering that there is a linea aspera in the back of your femur is not easy to do. So I will do for you what my teacher did for me 26 years ago, and for some reason it stuck. It's not terribly exciting, don't get excited. But he reminded me, and it stuck with me because my parents used to have a garden. And his parents used to have a garden. And so the story really matched up in my head. And he said they used to plant asparagus in the garden and back. They used to plant lines of asparagus in the garden and back. Or a linea asparagus in the lines in the garden and back. And it's stupid, but it just stuck with me. So I always remember the line of asparagus and back, and that's the linea aspera. And this is just a bumpy line, like all the bumps on your muscles and all that kind of stuff. But, and it's very convenient, the lateral lip of that line, the vastus lateralis hooks to. The medial lip of that line, the vastus medialis hooks to. And then they wrap around the front and come on down. So, anyway, that is the origins of those muscles before they go down and insert into the patellar and the patellar ligament and all that stuff. Let's see if they have the intermedius here for us. Hold on, because I really want to do intermedius next, if we can do it next. And they're not helping me at all. Why do we not have, am I missing? Oh, they just threw it in here, okay. The vastus intermedius, right? It's not on the lateral or medial side really. I know your book says it's on the anterior lateral shaft, but it's basically in front of your leg. And so it just hooks on to the front of your leg, the front of your femur. So you won't see that one behind, right? It's back in front. And the rectus femoris is running over the top of it. Got it. Okay. So all three vastuses, all four muscles have the same insertion. Three of the muscles have the same origin on the femur. And then one of these muscles has an origin on the anterior inferior iliac spine. Okay, let's find that, because this is super duper important to structural anatomy. All right, so we taped, did I pull all this off? What am I doing? All right, anyway, we taped all those bad boys up. Let me grab something here. Here we go. But we do have another muscle, the rectus femoris, right? Boom, 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 boom. Let me stop sharing this really quick. Here we go. All right. Got it. So we've got the little skelly here. And there is, if you follow the iliac crest forward anteriorly, you get to a bump here. Anybody tell me what this first bump is that I got to? Anybody know? The first bump, if I follow the iliac crest. Yes, Mr. Placencia, please, sir.
The anterior superior iliac spine.
Yes! So, Mr. Placencia, don't go anywhere. So, Mr. Placencia, if there's a bump underneath that one, what would I probably call that?
The anterior inferior iliac spine.
Beautiful. I love it. Really well done. And that's where the rectus femoris hooks onto. It hooks onto here and goes down to the patella and the tibial tuberosity, right? So this muscle can still kick your leg out, but it crosses over the hip too. So what's the other action that the rectus femoris can do?
Flex the hip.
Yeah, flex the hip. So it can actually lift your thigh up and kick your leg. It is a flexor of the hip. What's really important about that is, I don't even know how to ask this question. Mr. Placencia, I'm going to ask you, because I feel like you're good at figuring out what I really want to say. So it can cause a hip flexion, but is there another name and a way for a hip flexion? Like, what does that do to your pelvic tilt?
It will anteriorly tilt your pelvis.
Yeah, yeah. So he is recognizing, everybody, this is a hard kind of concept to get. But if these are this is a side view, right, of my leg. He's saying that if my hip comes out to here like this, that's a flexion. It's moved this way, but in reality that's the same as this coming this way. And if the hip comes forward, that's an anterior tilt, and that's a very hard thing to visualize. But if you imagine for a second, and it's very helpful to imagine this way because we're used to gravity. So in gravity, when there's gravity involved, it's very different when I flex here or bend here. But those were the same joints. The same thing happened. So in space, if I'm floating around, it's very hard to tell if my fingers came to me or my hand came to the fingers. I know you could see my arm move, but my point is in space, it's very hard to tell if these are getting here or that's getting closer to there. The fact is this is closing. And so a flexion of the hip is also kind of an anterior tilt, or it can create one. The fact is the angle in front is closing. So me bending over at my hip is anteriorly tilting and it's flexing. Right? Why am I obsessed with this anterior tilt thing? Anybody? I'm obsessed with it. Yes, Mr. Placencia.
Just related to the homework question, it can cause lower back issues or back issues.
Thank you, sir. So let's look at this. Everybody, let's give this person an anterior tilt. Let's say this is not straight there. It's like this. That's an anterior tilt. The hips are like this, right? Or, sorry, had to get some hips. Okay, or these hips are bending forward. Well, look what happens to the spine when the hips bend forward. It has to exaggerate the curve. Otherwise, what happens is if it doesn't, your head's out here. Nobody can walk around like this for very long. So what your body does is say, no, I'm not going to do that. So it exaggerates the curves of your back to help compensate and get your head back above you for your anterior tilt. And you'll work that back all day long, and you should, but it won't get better until you fix that. Now the curve comes back to a normal curve. That's why we care about anterior tilts, and they're the most common tilt that we see. They're not the only tilt we see, but they are the most common tilt we see, because when you sit at a desk all day long, when I sit all day long, I'm going to exaggerate this, but if these muscles shorten here, I don't get up all the way. Now I walk around like this to you, and I go, hey, my neck hurts. And you look at me and go, well, sure, your neck hurts, your head's way out here. You know, and I'm like, my back hurts too, because my body's trying to get my head back there. But you realize it's my hips that are the problem. My hips are the problem. And by the way, please don't misunderstand me. If a client comes in and their neck hurts or their back hurts, rub that first. They might be impressed with your advanced understanding. They might be appreciative of your advanced understanding. You should take their problem away. But first, address what's really bothering them, the symptom. Then try to fix the problem. Just like if you guys were panicking, you came running in here and you're crying, I wouldn't be like, well, let's look at your childhood. No, the first thing I would do is hug you and reassure you and calm you down and take care of the immediate symptom. And then I'd be like, let's look at your childhood. No, I don't know what I'd do at that point, but you get the point. All right, so anyway, that kind of gives you an idea of the 4 quads. And we will take one last look here. I just want to make sure I didn't miss anything else in this slideshow. Then we'll take a break. Then we'll come back and review. Then we'll do some homework, and then that'll be it. Yep. They're all fully palpatable. I know the vastus intermedius, you can't touch it, but you can telegraph right to it. It's easy to rub. Super, super easy to rub. Mr. Brown, I love your hair. Yes, thank you. Thank you for this. Yeah. And that's that. Okay. So let's stop right. It's okay. It's okay. What are the 4 quadriceps femoris muscles? What are their names? And I can say them with you. This is the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. I want to say those with you. Do you want to say them together? Just say what I say, okay? Okay. You're muted though, I can't hear you. Now I hear you. Good, okay. Vastus.
Vastus.
Lateralis. That was good. Lateralis.
Lateralis.
Yeah, it's really hard, the L's. Vastus. Medialis. Beautiful. Vastus. Intermedius. That was beautiful. Rectus. Rectus. Femoris. Thank you. You're good. You're golden. Miss Sarno, you got to do the same thing. You're working on, you want practice, you said, right? Let's do the 4 quadricep muscles.
Yep.
Do you want me to say them, or are you going to go?
Yes, I follow you.
Okay, understood. Vastus.
Vastus.
Lateralis.
Lateralis.
That was perfect. Vastus. Medialis.
Medialis.
Beautiful. Vastus. Intermedius.
Intermedius.
Rectus. Femoris. Beautiful. I love it. Cool. Thank you.
Thank you.
Miss Carodi? Well, first, Miss Carodi, what are the 4 quadriceps femoris muscles?
Rectus, femoris.
Rectus femoris.
Yeah, vastus lateralis.
Vastus.
Lateralis.
Yeah, lateralis. Yeah.
And vastus medialis.
Vastus medialis.
Yeah. Vastus intermedius.
Vastus intermedius. Thank you. Thank you, ma'am.
Thank you.
Mr. Brown. Mr. Brown, all 4 of those muscles insert into the same place. All 4 of them. Yeah. What is that place, sir? Now that you got your fancy laptop, you can Google it. Mr. Brown? Mr. Brown? Mr. Brown? Mr. Brown? You know when little kids are like, Mom, 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 Mom. And you're like, ah! I know. Mr. Brown, sir.
No, not the patella. Yeah, the upper border of the patella, right?
I mean, you're kind of right. So anyway, say it again, though. You got me confused.
I always get them confused. The kneecap is called the patella, correct?
Yes. So they all insert into the patella.
Yeah.
And then the patella is hooked to something else.
The patella is hooked to, isn't it, your tibia?
Yes! Dude, yes! That actually, even though that's not like a textbook, like perfect answer, I'm happier with that because it shows that you understand that your quad's hooked to your kneecap and then to your shin bone. That'd be the simple way of putting it, right?
I'll see it as a question because every time you ask me a question, I find what you're asking about like on my own body. So I'm like, this is the tibia, right? That's why I was like, because I'm like a hands-on learner, so I gotta know, you know?
Actually, everybody should be. That's why I always make the joke, this is the class we want you to touch yourself in when we're doing anatomy, right? Because we literally want you to feel the stuff on your body. If you can't find it on your own body, you're never going to find it on your lab partner, let alone a client. That's beautiful, sir. Okay, thank you. Thank you, thank you, thank you. Miss Munoz.
Yes.
What are the 4 quadriceps femoris muscles?
Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius.
Thank you, ma'am. Miss Vincent, where do all, you're making me want to vape, by the way. Miss Vincent, I these muscles insert?
The patella and the I don't remember the terminology again.
If you don't mind, if you think you know it, I don't care about the terminology. If I was 5 years old and you had to explain it to me, what would you just say? Like, it does not need to be perfect. I just want to kind of like what Mr. Brown did. Like, where does it go?
Right under your kneecap.
Cool. So it goes in. Well, it goes into my kneecap, and then right below my kneecap on what bone?
The tibia.
Thank you. Cool.
By way of the tibial tendon. I don't know.
Blah, blah, blah. Okay. So it inserts into the tibial tuberosity via the patella and the patellar ligament. But anyway, you said that, and I'm happy with that. Thank you. Awesome. Miss Estes.
Yes.
Miss Estes, what is the main action of the 4 quads?
To extend the knee.
Yeah, thank you. To make your knee kick out, to extend your knee, yeah. And one of those muscles crosses 2 joints. Do you know which one that is?
The rectus femoris.
Oh! And because it crosses 2 joints, it can do an extra action. It gets a bonus action. Do you know what that action is?
Yeah, it flexes the hip.
Yes! Oh my gosh. All right, so since you're like 2 for 2 right now, let's do one more. If a flexion of the hip can also be kind of like what kind of tilt of my hip in a way?
Pelvis tilt.
A pelvis
Anterior.
tilt. Thank you. Like, what's a pelvis tilt? All right, anyway, an anterior tilt. Thank you very much. Thank you. Miss Lobitz, why am I obsessed with anterior tilts?
Because it can affect the spine and the muscles of the back.
Yes. If you think about it as a foundation for your spine, your hips are always tilted. They're supposed to be a little bit tilted like this, and your body's used to that. When they tilt more, everything stacked up on there has to deal with it, right? Mm-hmm. That's why it's tricky. Cool. Thank you. Miss Mares.
Yes, Michael.
Miss Mares, what is the name of the 4 quads?
They are the vastus lateralis, medialis, intermedius, and the rectus femoris.
We'll take it. Rectus femoris. Thank you. Or femoris. You're absolutely right. Thank you, ma'am. Okay. That's that. Let's release some homework. That is kind of the quads. These muscles are amazing, but they're probably in some ways some of the easiest muscles to access, right? And in some ways fairly easy to understand because it's all kind of right out there in front of you. Later when we do fascial lines, which is how your whole body hooks all these muscles together to stand up straight, the rectus femoris is one of the front fascial line muscles, and you'll hear me talk about it over and over and over again. It's not that the other muscles aren't important. If somebody's having knee problems, especially, they're important, but alignment issues of the back can be affected by the rectus femoris. That's why I'm making such a big deal of it. Okay, you have 2 pieces of homework. You have just a 16-question test and a matching question from chapter 2, believe it or not. You guys are going backwards, of your book, which is on professional relationships, which we will talk about tomorrow, which is about boundaries and things like that. And we'll talk about how to do the very tricky thing that massage therapists have to do. And it is tricky. You don't want to be cold and distant. You want to bond with people, but you also want to let them know that that's kind of happening at work and not outside of work. And that's tricky. So we'll talk about that tomorrow.